We are a technology company with a focus on communications and virtual care as it relates to healthcare. I'd like to pose the question, telehealth versus virtual care, aka telemedicine. These names are used in unison, but really there's a big difference between what is out there today as it relates to telehealth or telemedicine, hence the word tele, versus virtual care. And so before I answer that question, a lot of well-known companies out there that a lot of us in healthcare use on a daily basis. What I really want to point out here is the progression and where you see technology going into the future. We started with our server and mainframe-based PM and EMR type of systems in the early 2000s with the EMR boom and meaningful use. We saw a lot of companies like Epic and Cerner really kind of take over the marketplace. And then after that, we started to see a lot of buzzwords thrown out there, population health, the cloud, patient engagement, analytics, and now most recently we're starting to move into quote unquote telemedicine, as you can see with Teladoc. Let's set aside healthcare technology for a minute and let's talk about just technology companies that we all use, and probably some of these apps are on our phones, on those everyday devices, and we use on a daily basis. In fact, some of you might be using a few of these apps right now while I'm presenting. But I think what's interesting here is these are technology companies first that focused on a certain industry to disrupt, whether it be the taxi industry, the movie industry. Amazon Prime is another great example of disruption in the marketplace. And so as you can see here, over the years, it's become more virtual, more on demand, more personalized, and using everyday devices that sit in our pockets on a daily basis. I don't know about any of you, but my thumbs start to hurt when I look at this slide and I see that BlackBerry. I spent a couple years on that BlackBerry and I think I got carpal tunnel from it. But I think it's interesting to point out the progression of mobile technology and how important that is when you look at other technology, especially as it relates to telemedicine or telehealth and virtual care. I mean, the iPhone, the original iPhone, as they say, the first smartphone was released back in 2007. That's just 10 years ago. 4G did not even exist 10 plus years ago. So it is a very interesting time that's going on in the marketplace, but I think mobile technology has really collapsed a lot of time frames when it comes to technology as it relates to healthcare. So let's go back to that question. Why is telemedicine an outdated term? These are just a couple of graphics of quote-unquote telemedicine systems or vendors or units that you may have seen, you may see rolling around the hospitals. The problem with a lot of these units and systems is it was point-to-point, so person-to-person or patient-to-provider. Very hardware heavy. If you see some of these rolling carts, some of these could cost upwards of $10,000 or $20,000. In fact, I think the one on the right also makes coffee as well. So, but I think what's interesting is if you look at mobile technology and what's going on, is everything's becoming more mobile, more virtual. Not only are patients asking the same question as doctors, hey, can I, use this device that's already in my pocket today? So the real question becomes, what happens when the patient isn't in that exam room or isn't in front of that unit? What happens if the patient's at home? They don't have a laptop or a computer. They don't have the internet. What happens if they just have a mobile phone? And the same goes for the doctor. So let's kind of talk about some of the barriers that we've seen, the most common historical barriers to telehealth or telemedicine success and adoption. We just talked about technology and how quickly that's starting to change and how we're now in a world of BYOD, bring your own device. Connectivity, as I mentioned, 4G didn't even exist 10 years ago. Anyone who's watched any television in the last so many months or years probably sees those Verizon commercials with 99% connectivity across the country. So quickly, even mobile and 3G, 4G, and what's coming down the pike, 5G, is starting to even replace internet in the home. And I think reimbursements used to be an issue, but now it's starting to change. In fact, the last statistic I looked at was 48 states are reimbursing for some form of telehealth, whether that be through Medicaid, Medicare, or through a private payer. And every week I feel like I read a new article about states also passing legislation to cover telehealth, i.e. Iowa most recently. But the one that I've underlined here is language. I think that is the most significant barrier to telehealth and now virtual care success. One of the questions that we always ask at Cincy is, what happens if the patient doesn't speak English? What happens if there's that language barrier? How do you communicate with the patient virtually? How do you still maintain that patient experience versus having to do something in person? Or what if the patient doesn't speak English and doesn't have Wi-Fi or a laptop at home? How do you engage them and how do you reach out to them? So this is really where the value of virtual care comes into play and how we're trying to push the envelope at Cincy and go beyond traditional telehealth. And so let's talk about those languages. One of the things that we've done is we've looked at the market, and 21% of US households today speak another language in the home other than English. So that's really 1 out of 5 patients. Here in Los Angeles, where I am in San Diego, that number's probably a lot larger. And so the question is you know, your virtual care strategy, how are you going to meet the needs of that patient population? Whether they speak Spanish or Mandarin or Cantonese or French or Russian. They may speak English, but they may prefer to, you know, have medically related conversations in their native language. And then the other question comes into play, and I'll use my dad as an example. My dad is in his late 60s, wanted nothing to do with technology, never accessed any of the emails I set up for him, doesn't even know how to turn on a computer. But since he got a smartphone a few years ago, that guy has not stopped texting me. He will not stop FaceTiming me and my wife to talk to my daughters, i.e. his granddaughters. And you know, I think it's funny because he's a great example of someone who just decided to tune out of technology for 10 or 20 years, and then all of a sudden decided to adopt the iPhone, right? And so again, I think it comes down to the user experience. So what we've done and what we've designed is basically took FaceTime, reverse engineered it, made it capable of on any connection and any device, anywhere, anytime, with any language, so that you can communicate with patients of all different languages, including the deaf and hard of hearing, no matter where they are in America. And so something that we're working on today, and I'd love for you to come by the booth and check us out, is patient program management. Patient program management is where you take that patient cohort and you put them into a program. Let's say you have high-risk patients that have been discharged. They have congestive heart failure. They're over the age of 50 or 60. Their preferred language is Spanish, and their preferred communication protocol is text over email and over video or audio. We can put them into a program and schedule those visits, but the text messages are in their native language, written by a medical interpreter certified on 200 plus languages. Same thing goes with the virtual visits. So this is where we see the future of virtual care, is putting patients into a program based on a cohort, based on a diagnosis, based on a language barrier. And then how do you better engage with the patient, but how do you let them engage back with you? So with that being said, I thank you for your time. I'd love for you to come by the booth at Cincy, and we can give you an actual hands-on demo with some of our iPads and iPhones. I apologize, the iPhones are not giveaways, but I'd love to have you come by the booth. Thank you so much.
So we all know Ed Snowden and what he did, or some people may not know what he did. He actually went around as a Booz Allen contractor and was asking for username and passwords, and basically it was, I'm from IT and I'm here to help, and can I get your username and password? And people gave it to him. And it was people with higher security access than he had. And then the rest is history. But in healthcare, who is it we're really worried about? And it's usually insiders. And this is not what this guy looked like in the story I'm about to tell you, but it represents of what happened. So I got a call from an attorney a couple weeks ago, and he said, hey, Rob, you know HIPAA, don't you? And I said, well, I know that there's no PP in HIPAA. And I have a joke for the spelling of HIPAA, by the way. I said, but yeah, I know a little bit about what's required and what people are doing. And he said, well, I got this client, and it turns out she's in the middle of a divorce right now, a custody problem. And her new husband was at a party at a local community event, and people knew he had prostate cancer and some other things about him that was pretty unusual. Now, that was unusual because people at the party didn't really know this particular gentleman, and they hadn't told anybody about his health conditions. So they thought, well, that's weird. We're going to go to this prominent health system that's using Epic and figure out who's been looking at his record. Because the health system itself hadn't identified it and hadn't flagged anything that was unusual. So they pulled an audit log out of Epic, and it turned out that her ex-husband and his partner, who are both physicians, had been pilfering around this guy's record and had been disseminating this information out to the community. And I kind of led the attorney down the pike of saying, here's some of the CFRs around the HIPAA regulations on user activity review and all that, and looking at the malfeasance side of it is from an attorney perspective. He was very, very excited, I can tell you, this attorney, because he knew he has a civil case against this large entity that's an Epic customer, and they're going to get a huge settlement. Now, what if they'd had, the right kind of AI in place? That would have been something that would have done. So this doctor, by the way, was so out of control that he sent a email and documentation into the court saying that he had talked to the health system and they were okay with what he did, but he fabricated the entire thing. So there's some bad actors out there, and a lot of them are internal. So what are some of the use cases that we see out there? One of my favorites is the one in the middle, the doctor arrested for prescription fraud. He was in that record or in the system for 2.5 years, writing himself prescriptions, going into patient records and modifying their records and writing prescriptions and then impersonating them at the pharmacy. Took him a couple of years to catch, and it was caught in a drug raid. So an outside entity caught the doctor and then went back to the health system and said, did you know that this doctor's been in your system for 2.5 years causing trouble? They didn't know, as it turns out. They are facing stuff. The other one I think is interesting is the one up on the upper right from your perspective, the Dark Overlord. And if you haven't heard of the Dark Overlord, they're a group out of Europe somewhere that are going into systems all across the United States and holding systems hostage with ransomware. But that's not all they're doing. In this case, they got into a server of Athens Orthopedics and got all the username and passwords. And from there, they spent 3 weeks exfiltrating 400,000 records and then put them up for sale on the dark web. Had they had a tool that could have recognized that the behavioral access of these users that were being impersonated were not the users, they could have caught this very quickly, but they didn't. For those in California, these are some of the local California problems. The one you may have heard about was the plastic surgeon here who hired someone, and in the first 6 months, they gave a receptionist access to the EMR who was then downloading celebrity information. And they actually let her into the OR when they were doing the surgeries, and she was taking pictures with her cell phone. That might result in a pretty hefty OCR fine and some civil liability that's coming down the pike. I'm going to pass this so we don't run out of time here. Obviously, these are some of the HIPAA requirements around this. So what's the landscape look like today? The landscape today is that there's bad actors out there. There's people that are inside the health systems themselves that are snooping on records, whether it's relatives, co-workers themselves, that sort of thing. And how do you address this? How do you catch it? Because not only is it required under HIPAA that you have some sort of activity review issue, how do you do it in a way that is effective and not chew up all of your internal resources as an FTE? Last year there was 170 million records breached. There was 18,000 patient complaints last year to the OCR, which result in them coming on site to figure out what's going on with the patient records. And the typical hospital or clinic can generate anywhere from a few 100,000 lines of activity per day to millions and millions of records. So how do you do it? It's impossible to do manually, but you have to do it. You need a new team member, and the team member is AI. You need the ability to bring in the AI to pull in some cases, hundreds of millions of records, to machine learn it and then output the information for the alerts and potential malfeasance, and do it in a way that doesn't kill the FTEs that are already there. I had a call with a lady out of Michigan 2 days ago. They are under OCR audit right now from a patient complaint, and it's just her. It's a hospital with about 16 clinics, and what she's facing is, I've got a few 100,000 lines of activity. I'm generating so much data, I don't know what to do with it from a manual perspective, and I'm auditing 20 patients a month to meet the HIPAA regulations. She's like, there's no way that's going to pass muster when OCR starts to come at me. And I said, well, you need AI because that's your newest team member. And that's what we're doing. This is our story. And come see us afterwards. I think my time is up. I appreciate your time. And where's Sphere?
Internet of Things. Everybody's heard it. It's a big buzzword. What do you think of when you think of Internet of Things? Think of Alexa, Echo, maybe a smart Samsung refrigerator or something of that nature. So I'm going to ask for a show of hands. How many of you have a smartwatch or a fitness tracker? Okay. How many of you also use an app with that fitness tracker or smartwatch? Okay. How many things does that device record? Certainly takes steps, might do your heart rate. Depending on the model and what it is, you might have a GPS, might have a lot of other things associated with it, like they might have accelerometers, things like that. So one of the questions is, what do you do with all that data? So that's what the app's for, right? So you've got a big mass of data aggregated over time that you personally have access to, but kind of, okay, so if you're training for fitness, nice. If you just want to make sure you're walking around periodically, nice. But what does that, again, what does that have to do with healthcare? Well, when you use that app, you have a whole bunch of sensors in that device, and you also have that application. How does the data get from your device to the application? How many of you have one of these? So your cell phone is typically a gateway, what we would refer to as an IoT gateway for that fitness device, right? So what's happening is your fitness device is talking to your cell phone's relaying the data up to the application in the cloud. That's how the data is getting there. Did you know that your cell phone also has a whole bunch of other sensors in it? You're probably aware that you've got a GPS, because you use that. But did you also know it has an accelerometer, a light sensor, a magnetometer? A lot of other sensors that are in there that might be in use, might not be in use. Okay, so again, really nice. We've got that device, we've got all these sensors. So what do sensors do? Sensors tell us what is actually happening in our world. And that's nice. Again, it's a lot of data. We're aggregating a lot of data. But again, what does that have to do with healthcare? Well, the next question is, what do you want to do about that? What do you want to do about what's happening? So for instance, if I had a heart rate monitor and my normal heart rate is, say, 65, and suddenly my heart rate's going like 150 or 160, what do I want to do about that? Your application's going to record it, your device is going to record it, but nothing really happens, right? But what if you could do something about that? That's part of the promise of IoT, right? So now I have that sensor that's telling me what's happening, and I decide what do I want to do about that. So let's take a couple of examples. Think of, say, something like chronic care, somebody who's diabetic. And that person, that person is supposed to be monitoring their blood sugar regularly. They're supposed to be taking their insulin regularly. So if you had an IoT-enabled blood test device, you could actually be relaying that information into the cloud. You could be checking to make sure they're taking their insulin correctly if the pump was IoT-enabled. So now what happens is, if I have that kind of capability, I can decide how I want to respond to that. Similarly, for instance, you take somebody like an Alzheimer's patient who maybe is wandering away from the place that their care is being given. We can set a geofence and kind of go, what happens when this person wanders outside that geofence? I want to alert their caregiver to go track them down and get them. Or, for instance, I have one of the most common challenges for elderly is falls and breaking hips. So your phone, as I said, has an accelerometer in it. It can actually tell if you fall. But right now, nothing happens with that. So what you want to do is what we would call a workflow. And the workflow drives what the medical value is going to be. So if I have, you've probably seen on television recently, there's an ad for something called CardioMobile, right? Where you see the person put their fingers on a little test pad and it goes, oh, your heart rate's normal. What they don't show you is what happens if your heart rate's not normal. It doesn't do anything right now. It just gives you a nice sense of calm, right? What if instead, if your heart rate was abnormal, it either triggered you to the advice nurse or called 911 if necessary, or something of that nature? That's what that workflow is. So workflows can be customized to do what you want them to do. So now think about some of the environments in which you work. I'll use a simple example. We're talking about things that are triggered by sensors, but there are all kinds of ways to trigger workflows. So we take the example of a person who falls, and maybe what we're going to do is we're going to just call their caregiver and make sure that somebody checks on them. You might have an environment instead where, let's take in a hospital, you have code blues and code pinks right now, where typically you call the hospital operator, and the hospital operator starts calling people to execute what the workflow is supposed to be. What if that happened automatically? That as soon as somebody called a code blue, all the people that needed to be contacted were contacted automatically, put into a conference, and allowed to respond to that code blue event immediately. That's the power of workflows. So workflows can be triggered by sensors, they can be triggered by manually, they can be triggered by other events, or they can be triggered by business practices. So the value of IoT and integration is in those workflows and how you want to respond to them. And the reason I have this governance and cautionary tale up here is because we've all recently seen some interesting things happen with data that wasn't supposed to get out, right? So think of all that data, just think of what all your fitness tracker or Fitbit is gathering, what's coming into that data depository right now today. And think of what could happen if that data was in the wrong hands. And I'm not saying that we're going here or not. I'm not saying that we shouldn't go here. What I'm saying is this is the kind of conversation we have to think about. So, for instance, my particular healthcare provider has a wellness program. And part of the way you earn your HSA contribution is by being active. So they're tracking my fitness tracker, and I have to do certain things to earn that HSA requirement. There's nothing that says we can't go farther than that, right? When you sign up for healthcare, should we know, for instance, if you say you're an active person, should we know that your Fitbit's lying about you, or is telling the truth about you? You've said I'm a very active person, and your Fitbit says, not really? So do I pay a different premium then? Or for instance, maybe I'm a person who has high cholesterol, and you're supposed to be taking a statin. And what happens if your smart pill bottle says, well, he missed about 20% of those statins? Then what happens when we go to the heart procedure? Do I pay a higher deductible because I wasn't taking all the statins? Or is it denied? So that's the kind of conversation we have to have as we start talking about integrating all these different IoT devices in. And I think we need to talk about it now rather than later. Those are all legitimate uses. But we also saw what Cambridge Analytica did with data that they weren't supposed to have, right? So the same thing potentially exists with all the data that's being gathered by IoT devices. So a lot of promise, a lot of capability, a lot of value in IoT devices and automated workflows, and also a risk that we need to start talking about. Thanks for your time.
Good afternoon. My name is Dan Engel. I'm one of the product managers at M-Modal, and we are a clinical documentation company focused on capturing documentation and also reusing documentation. So our two core technologies are speech recognition and natural language understanding. In January of 2017, The Economist put out an article, Now We're Talking, and they said that speech rec devices are really well equipped and ubiquitous now across the market, and I think everyone probably knows that with their smartphones and the mobile that was mentioned earlier, and also Alexa and Google Home, and people expect to have speech recognition available to them, and doctors are included. And doctors use speech recognition and our technology to capture documentation, to alleviate the burden you see sometimes with having to type and use templates inside of the record. Sometimes speech is an easier modality to capture your notes. And this year, The Economist in February wrote that data is transforming healthcare, and that's because of all the electronic records and the amount of information that we're able to capture in a short amount of time. But there's a problem there. There's also reports about up to 50% of physicians being burned out, and that's because they're balancing the need and the goal to deliver high quality care while also being required to navigate the EHR, to capture documentation, to comply with regulatory guidelines and make sure that they don't miss any of the information as the guidelines change year over year. So when you look at where that burnout comes from, you see other studies that have different numbers, but on average, about 50% of the day can be spent with EHR work, while only 30% of the day is dealt with the patient. And this is not what providers want to be doing. They don't want to spend their day putting orders into the structured medical record system. They want to have more time with their patients. So this article came out in 2012. See some head nods. You've probably seen this, right? That the doctor wrote this article that was happy to get this picture from his patient. The patient was proud to draw her experience at the physician's office. But you see her sitting on the table on the opposite side of the room with the doctor's back to the patient while he's on the computer. So we're working with the EHR vendors to try to address this problem. We want to improve the workflow in the system and make it easier to get data in there so that doctors have more time with their patients. So I want to tell you a little bit about how we do that. We have a lot of different workflows that I talked about for dictating and capturing notes, and we started in 2012 focusing on the desktop and being able to speech enable that electronic medical record. And I mentioned Epic, but we also work with 150 other vendors because we want to allow the providers to document anywhere they use their systems in any format that they need to. In 2014, we expanded that tool to not just help capture notes, but also give real-time feedback to physicians while they're documenting to make sure that everything is correct and compliant the first time. So this would be feedback that prevents the need for a CDI query while the patient's in the hospital, or a message that summarizes what diagnoses are relevant for risk adjustment that are not yet captured this calendar year to make sure that they're compliant with these new HCC value-based programs. And now last year, we added on more functionality to also virtualize the documentation process and allow the physician to connect to a remote virtual scribe, as opposed to the scribe having to be in the room and potentially distract from the patient conversation. We have our scribes virtual so that they can help the doctor without actually interfering with that patient experience and not force the doctor to look at these real-time feedback messages, but have the scribe vet those and triage it before talking to the doctor. But locking a physician to a desktop isn't the answer, so we also have mobile solutions to capture and connect with your scribe, and even to dictate and see the text come up right away. You can edit it on your device and save it and get it done all on the go. Now into this year, we're moving like Alexa and Google Home from a desktop or even a mobile experience to a more ambient experience. Take the microphone out of the physician's hands so they don't have to dictate in the computer. Remove them from the keyboard and put a little device like this in the room that will listen to the physician-patient conversation and summarize all the information that should be in the record for them. And whether it's in the room or on the go while they're navigating the hospital with a wearable, we want to bring that experience from hands-on in the computer to more ambient and turn that doctor around so he's not stuck working on the computer with the patient, talking to her family. The physician can actually engage with the patient. So we want to move from just initially speech enabling the record where you talk to the computer to starting with a conversational agent where you can talk to a virtual assistant and they can help get the orders queued up for you to finalize, as just one example, or to look up information about the patient in the chart. Ultimately then making it an ambient experience, just like you have with Alexa in your home, maybe just to ask for the weather or simple tasks that you're used to as a consumer, allow the physician to have that same experience in the patient room. So hopefully we'll turn this picture around and not have the physicians back to him, but actually re-engaging with their patient. And so that's what we do with M-Modal. We want to create time to care. We'd be happy if you came by to see how this works in action and answer any questions you might have.
My name is Neeraj Bhavani. I'm the founder and CEO of Tagnos. I spoke this morning, and I thought I could maybe change topics, but they said, no, you got to still talk about Tagnos. So I'll try and see if I can say the same story in a different way. So the number one thing I want you to remember about our company and what we do is we're trying to improve customer service inside hospitals, right? I mean, think about a scenario where even if it's a simple outpatient procedure like a GI lab, that you drop your family member and then you go to work, you absolutely have no idea where they are inside that service line. You know, are they waiting before registration? Are they in registration? Are they waiting after registration? Are they changing dress for the procedure? You know, are they in pre-op? Are they going through procedure? Are they recovering? You have absolutely no idea. It's just a black hole for you, right? My mother-in-law went through a knee replacement surgery. It's a different story. That we were waiting in the waiting room, and we were trying to find out when is she actually going to come out of the procedure room, right? And it was a local Orange County hospital, and I know me and some of the family members were waiting for almost 3 hours in the evening. I went in there at 4 p.m. and I sat there until 7 p.m. There was a older lady, as I call it, as a service counselor, a volunteer, a very nice woman trying to help. She's trying to let us know where the patient is in the flow. And she was going back and forth trying to make phone calls. Had no idea, had absolutely no idea where the patient was in the flow, right? So that's the problem we're trying to solve with Tagnos. It's a problem which is actually, if you think about it, it's not too complex to solve. Yeah, we use IoT to track patients with bands. We use AI to do machine learning to predict events. Yeah, we use Alexa to record some milestones in OR. Yes, we take some data from supporting systems inside the hospitals like EHR, CPOE, labs, radiology, but who cares, right? Who cares? End of the day, are we actually providing the customer service that we all almost demand these days, right? From everything else, except for hospitals, you're okay. It sounds like we all kind of accepted that it is what it is going to be, but obviously with the consumerization of healthcare, with all the technology, with all the text message updates that you get, you are actually demanding a significant improvement in customer service, right? So that's the problem we're looking to solve. And we're at 10 hospitals now. We have solid data, raw data from few of the hospitals on how we're able to shrink the cycle time or the departmental length of stay, as they call it. We also have some strong evidence of AI algorithms working. Like this morning I mentioned that we can predict the case length in OR with 93% accuracy. That was a pretty significant win for us. We actually struggled almost 3 months to solve that problem. We had two hospitals give us, one hospital gave us 5 years worth of data, the other hospital gave us 11 years worth of data, and we actually worked on that, and now we can solve that prediction of case length in OR, so the hospital can do better scheduling, can actually even do the room turnover, right, with being more efficient with the room turnover as well. So, where we are as a company is that we're looking to scale the business now, and we were incubated by Cisco. We were incubated by a company called Evo Nexus out of the UCI area, and last month we raised $5 million in venture capital money. 3 different VC firms participated. We have a little bit of more money left in the round. We raised 5. We have about $500K left in the round. Cisco and possibly Intel are going to come in and take the remaining money. So we have a lot of support. We have big logos behind us, right? We have Stryker, we have Cisco, we have Siemens, we have Zebra. We have a lot of these companies trying to resell our product. And we're ramping up the team, and we're excited about where we are. But again, think of Tagnos as a patient experience or customer service company. I would have failed in my job if you left this room thinking we're an IoT company or an AI company or Alexa company or a data integration company. As I said, who cares? As long as we improve customer service, we're here to win. Thank you.
So one experience I have to share here is that we are talking about all this technology here. Definitely this room needs real good infrastructure from the Wi-Fi connection. I was so hoping that I could give you guys a demo of our Alexa as well as Google Home. It was working fabulously fine in the innovation lab, but it is not here. Unfortunately, I have to take you guys back room. Happy to provide you the demo. But here is what Sutter Health. Like I just mentioned, we are here serving the communities more than 100 years. You just see how old we are. I'm not, by the way, but 12,000 physicians, 24 acute, I think now it's 26, 53,000 employees, $12 billion revenue. So just a good sizable network of hospitals we are. Please go for the next one. So, we care, definitely every healthcare community care about their patients. Considering the current scenario where we are, we have a lot of good digital platforms. So we wanted to make our patients to be able to access the information whenever they need, very easily and very efficiently. So right now, we can find all this information going to our websites. And if you want to find out a provider, if you want to find out a specific provider for a specialty, you will have to go to our website and then see. Yes, you have that information, but everybody was talking about smartphones. Okay, I have these smartphones. How can I find all that information just by using my smartphones? So what we did was we tried to use the available technology, including Facebook. We created a chatbot. It's automatic messenger. You try to send a message using your messenger. It will respond to you. I'll show you that demo because that's working right now. We also use the Google Home as well as Amazon Alexa. Basically, we have used, next one, slide please. So we basically use those devices as well as technology to basically provide, the physician's information as well as the specialty information as well as the location, how far that location is from your current location and how far it takes and what is the wait times for those things. So I'll show you the little bit demo of our Facebook chatbot, how we have utilized this Facebook chatbot in order to be able to showcase our patients can access all this information that is available on our website, but I hope I'll be able to show this screen. Evan. Okay. Come on. Right, I had to stop the PowerPoint presentation for now. Okay. I hope I'll be able to see this. Got it? All right, so my cell phone. So go to find, here is my list. And if I want to find out, Sutter Healthcare, go there and find Sutter Health by typing in. You will be presented with welcome message. Definitely it uses your profile, like Mark Zuckerberg. Either your name with the welcome message. And there is a disclaimer. Any healthcare provider has to provide the disclaimer where you have to say that if it's an emergency, please call 911. And then if you don't know anything, just say hi. Then it will provide you the options for you to tell, okay, what are you looking here? You want to find a provider? Yes, you can find a provider. By just selecting that, you will be given an option to find out the provider as well as the location. And then you say that, yes, you want to find out the location of the provider. Then it will ask you, enter zip code of your provider. Say you want to find out the provider by the zip code as well as the location. Then you have to enter the zip code of the location where you would be searching for your provider. Then it will ask you basically what provider, sorry, give me one more second. Hope my developer is not messing up with my app. All right, so it's now giving me action of how you want to find the provider, by the name, by the specialty. I say, okay, I want to go by the specialty. Then it is going to connect our Sutter Health Network server. Basically, it will display all the providers that matching to that location for that specialty, and it will display all the providers available here. I can just go through the providers here. Network is really, really bad here. I'm sorry. It's not loading properly. I should be seeing their pictures as well here. say for example, if I were to choose a specialty, then I would say select pediatrics. The moment I select pediatrics, it will display all the pediatric specialty providers available in our network here. Then I should be able to select some of the network, whatever the providers I would like to contact. Then this app also provides me their phone number, their contact, as well as the, if I would like to call this particular provider, I can always go back and then call from here. Or if I want to get a direction on how to reach there, we are using the navigation, Google Map. It will also provide me how to navigate over there in order to be able to reach provider. I can also make a call just by using my app. So that's about just the Facebook chat part. I really wanted to show these two devices, which are really, really nice one. So using those devices, what we have done is that we have implemented the same functionality for these devices. If I utter any of these devices by saying that, okay, I would like to book an appointment with a particular provider, it basically asks my location, which location I would like to make my appointment. Then based on that location, it will identify what is the distance between my current location to the provider I would be looking at. And then it will tell me what is the wait times of that provider. Is that provider wait times is good enough for you to travel, or you want to look for another provider which is a shorter duration. Then I have an option of choosing which provider I would like to go with. Then I can ask the Alexa or the Google Home to book for me an appointment. It will book for an appointment for me. As well, I can also do a medication list. If I want to see what all the medications I have in my patient and my chart, Alexa or the Google Home basically tells you what medications you have on your chart. In order to be able to do that, we have to have a multi-factor authentication to be able to provide for this device to access my chart. Otherwise, we can use these devices to basically get all the information we just talked about here. You can find the providers, find the locations, find the wait times of a particular specialty. You can go, call them. You can get their address. You can get their hours of operations. You can do all those things. But in order to be able to access your chart, you have to have your multi-factor authentication provided. It can be done through your voice, as well as it can also be done through SMS sent to your app, so that you can read it out and then it will authenticate you to get the information what you're looking for. So this is not yet live. The second part of the EHR integration, it is under development. We are planning to release it, and then there are future developments are also considered happening by using these devices. If anyone wants to know this demo, please contact us. We will be in the back room. We're happy to show you the demo. Thank you very much, and so sorry for the technical difficulty.